And welcome back to Talk of Alabama. We've got Dr. David Moore from Andrews Sports Medicine and Orthopedic Center joining us now. And today we're chatting about the benefits of a total joint replacement. Welcome to you, Doctor.
Thank you.
I think you're new there. Well, you're not new to medicine. You've done it at UAB for about 15 years.
Correct.
But you've been at Andrews Sports Medicine for, what, a couple of months?
Joined the group 2 months ago. Was at UAB for 15 years before that, so Birmingham is home now.
You're an orthopedic surgeon.
Yes.
And you see a lot of this hip replacement and knee replacement, right? What would you say to those people at home maybe considering such a surgery?
Well, so, you know, Andrews Sports Medicine has sort of built its reputation on returning people to the NFL or Major League Baseball or Division I sports. But equally important to us is people being able to get back and go golf or play tennis or just go to the store. And for folks who are having difficulty with their hip or knee from arthritis because they've got chronic pain, then there's many different ways that we can potentially help those folks. And that doesn't usually involve surgery to start off with. Okay. We have a whole team of physicians who do non-operative orthopedic care and do a great job. But for what I tell my patients is, if you've got pain in your hip or knee that's keeping you from doing the things that you otherwise enjoy, that's the time to have that discussion about the potential for surgery. And
a total hip replacement, is that something that's common these days?
Yes, total hip replacement has really blossomed in a fairly short period of time. 1984, there were less than 10,000 hips done in the United States a year. In 2015, there were 330,000 done, so it's becoming much more common.
I was going to say, what about if people are at home watching, they think, if I have to have that done, is this going to be life-changing as far as rehab and physical therapy, and am I going to have to be out of work, and what do I expect?
Right, so it is life-changing, but it's life-changing in a good way. There is some rehab involved in it for sure. Okay. But this is about, the whole operation is about restoring your quality of life and allowing people to get back to the activities that they enjoy or need to do. And it takes a little work on the part of the patients for sure afterwards, but it's very well worth it.
And who, as far as age range, is it the baby boom generation? What are you seeing now as far as the hip replacements?
Right, so, you know, 20 years ago when I started doing this, we were primarily seeing people who were 65 and older. Yes. It's a much younger population now. I think some of that's because the baby boomers are less likely to tolerate not being able to do things they enjoy. Yes. I think part of it's because we're a much more active population than we might have been then. And so people want to continue those activities. Yeah,
that's right. And as far as, you said the rehab, and then they can kind of go back to their normal life. Yes. And do everything that, you know, within moderation, I assume they did before.
Within moderation, I mean, and that's the conversation I have with patients on a fairly routine basis. If we can't get you back to the activities that you want to do, then it's probably not worth having the operation. The idea is to be able to make you active again and enjoy life.
That's big. What do you want to say to viewers at home that I didn't ask you, that you think is important to convey to people about hip replacement?
Well, you know, in part because of a few bad implants that have been in the press a lot recently. It's gotten a little bit of a bad name. This is about the best operation that we have in medicine. When people look at dollars spent for quality of life restored, really nothing is better than hip replacement surgery. And although there have been some implants that have been problems, for the most part what we have now is much better than what we had in the past. Yes. And we have some techniques in terms of muscle sparing approaches that make it an easier operation, and an operation that's likely to last a lot longer than it was just a few short years ago.
And what about if people are afraid, think, oh, I don't want to go get checked out, I don't know if I need it or if I don't, but...
Well, there's, you know, just because you walk through the doors of the doctor's office doesn't mean you're signing up for surgery. Yeah. We'd love to see people who aren't ready for surgery. And again, we've got a whole team of physicians who are dedicated to doing just that. Yeah. It can't hurt to go get it checked out. And there are some things that we can do short of surgery that might be enough to allow people to be active and have a great life without having to have the surgery. But if they do, it's a great operation to have. And folks get the idea that they ought to be crippled before they commit to that. And I mean, I think the big message is it's best to not wait that long so that you can enjoy your life.
You know, I hear it a lot. I hear a lot of people that are grandparents and even neighbors of mine say, you know, we don't want to go out and run a marathon, but we want to be able to get in the kids on the floor and play with our grandkids, you know, and do the basic things.
Exactly.
Okay, the website, andrewsportsmedicine.com, the phone number on your screen as well. So if you've got any questions about any kind of joint replacement, especially hip, this is the guy to talk to. Thank you so much, Doctor, for being here. We appreciate it.